Good afternoon, and thank you for joining us today to prepare for the 2018 Public Health Day on the Hill. My name is Janine Moody, and I serve as the Executive Director of the Iowa Public Health Association. It's my privilege to moderate this afternoon's session. A few housekeeping tips before we begin. Due to the number of attendees on the webinar, all participant lines will be muted. To submit a question for our presenters, please use the questions feature in your GoToWebinar control panel. I will monitor all submitted questions and pose them to our presenters during the question and answer portion of the webinar. A few technical tips for optimizing your webinar experience. Utilize a USB headset if available. Use a wired connection versus wireless if possible, and close any applications on your computer which require large bandwidth. For many years, the Iowa Public Health Association has hosted IPHA Day on the Hill for its membership. In 2013, IPHA joined the Iowa Counties Public Health Association, the Iowa Environmental Health Association, the State Hygienic Laboratory, and the University of Iowa College of Public Health to host the first Public Health Day on the Hill. This collaboration is an easy extension of the strong partnerships already in place among these entities. And for those of you who can't be with us on Wednesday, because we understand that travel to Des Moines in January can be a dicey proposition, although hopefully not this year, IPHA always extends to our members the opportunity to participate in a virtual Public Health Day on the Hill. Please look for an IPHA action alert with talking points and messages to convey to your legislators via phone or email that day. By engaging in the virtual Public Health Day on the Hill, you can amplify the public health presence at the Capitol. Now let's meet today's presenters. We're appreciative to have members of the IPHA Advocacy Committee joining us today. Lena Tecker-Reinders serves as the IPHA Advocacy Committee and will provide an overview of the logistics and helpful tips for participating in the 2018 Public Health Day on the Hill. Brian Haniff and Eric Bradley, also active members of the IPHA Advocacy Committee, will offer best practices and tips for engaging your legislators. Julie McMahon serves as the co-chair of the IPHA Advocacy Committee and will join Lena in a quick review of our 2018 legislative priorities. And finally, Deborah Thompson, who is the policy advisor and legislative liaison at the Iowa Department of Public Health, had planned to be with us today and provide a status update on bills that have a public health impact. Unfortunately, Deborah has an ill child this morning and is unable to be with us. But she and I had a quick phone call and just touched base on some of the highlights of what she was going to cover, so I will attempt to do that in Deborah's absence. We will hold questions until the end of the presentation. To submit a question for our presenters, please use the questions feature in your GoToWebinar control panel. I will monitor questions and pose them during that period. Now let's turn it over to Lena.
Thanks, Janine, and thanks everybody who's joined us on this webinar. And we are looking forward to seeing all of you at the Capitol. I just want to go over a few logistics to help you prepare for our Day on the Hill. First of all, familiarize yourself with the IPHA legislative priorities before you arrive. You can find the priorities on our website. It's iowapha.org. If you go to the home, once you're on the home page, you just go down to the left sidebar and find the advocacy link. Click on that, and you'll get put to our advocacy screen. You can ignore the login box. It's not necessary to access the priorities. You'll see on the page that there's two groups of policy statements, the IPHA priorities and the IPHA position statements. The priorities are the issues that we will be actively pursuing throughout the session as decided on by the board. The position statements represent IPHA's stance on various topics of public health concern that often come up during the session. So we just want to be prepared with our position statements for when they do come up. Each topic is explored further under the topics menu on the website. You'll go there. If you go there, you'll find lots of links and information on all the priority areas. And we will be discussing the priorities later in the webinar, and there'll be opportunities for you to ask questions. And I should emphasize that no one is expected to be an expert on all or even any of these issues. We just want everybody to be an advocate for them. And so we're asking you to read through them, print off the ones you're most interested in and most comfortable speaking to, and also print off copies that you can share with your legislators. Okay. Second, as you prepare to actually physically attend the Capitol, if you're able to do that, we wanted to give you some hints for where to park and how to arrive and things like that. So first of all, carpool if you can. There is ample parking at the Capitol, but it might take you a while to circle and search for spots. So if you can carpool, all the better. Do allow extra time and be prepared to walk a block or two. I've highlighted the visiting parking areas on the map that you should be seeing on your screen right now. And go ahead and print this off on the slides if you think that'll help you find parking once you're there. The Capitol is right in the middle of that map. And once you reach the Capitol, the public entrances are on the south and west sides of the building. They're highlighted here on this map here. You'll enter on the ground floor and go through security. From there, you'll proceed up to the first floor to the IPH table that will be set up within the rotunda area. There'll be lots of opportunities to meet fellow IPHA members, colleagues, and legislators. If you've never met with your legislators before, you may be a bit nervous. So Brian and Eric are going to give us a few tips later on in the webinar for preparing to meet with your legislators. But now we're going to hand it over to Julie, who can start us off with our review of the IPHA legislative priorities.
Thank you, Lena. And thank you everyone for joining us this morning. As Lena has already mentioned, we have the 2018 policy priorities on our webpage under the advocacy. Throughout the year, IPHA assesses those issues that are important to our membership. And then we review the policy priorities and position statements that we've had in previous years to see if they still apply to the member issues and if they need updating or further editing. We've done that this year, and now we have the 2018 policy priorities. The first one that I'm going to be talking about is rethinking Iowa's public health funding for a smart return on investment. You all know that across Iowa, public health departments vary in their capacity to carry out foundational capabilities, in part because funding to provide public health services is often variable, unreliable, and not sustainable. The foundational public health services is a conceptual framework outlining the capabilities and areas or programs that no health department should be without and for which costs can be estimated. The framework also leaves space for additional important programs and activities that are specific to the needs of the communities served by the health department. Foundational capabilities in this minimum package are not strange to you. We've talked about them before. They are assessment, preparedness and response, policy development and support, communications and public education, community partnership development, and organizational competencies. Our priority is, and the solution that we offer, is that we restructure public health funding in Iowa to assure a minimum package of governmental public health services that is predictable, justifiable, and scalable to each jurisdiction's population size and capacity. With that, we believe that all public health departments would be able to provide the minimum package of public health services that would ensure the foundational capabilities of public health. A second policy priority is advancing health in all policies. Lena, do you want to take over?
I sure do. For this past several years, Iowa Public Health Association has been working hard to educate members and legislators on taking a health in all policies approach to decision making. And hopefully you're all familiar with that phrase, but I'll just do a quick review. Basically what that means is that we recognize that decisions made and actions taken beyond the traditional scope of health or health care actually impact health a great deal. And that the best way to ensure that Iowa truly becomes the healthiest state in the nation is to work collaboratively with all sectors, from housing to transportation to agriculture, education, and rural and urban development, and all. Truly, all sectors have the ability to impact health. We just want to make sure that those impacts are positive ones and create win-win situations across government. An important data-driven tool that we have that informs decision-making on health impacts of policies and programs is called health impact assessments. A health impact assessment brings together scientific data, public health expertise, and community input and commentary to identify the potential and often overlooked health effects of proposed new laws, regulations, projects, and programs. It offers very practical recommendations for ways to minimize the risks and maximize the opportunities to improve health. Iowa is one of only 6 states that has not yet started using this tool at some level of policymaking. And given the forthcoming budget reductions or predicted budget reductions, the imperative to work collaboratively across sectors and to use evidence to guide our decisions has never been greater. Therefore, Iowa Public Health Association's recommended policy solutions to promote health through cross-sector collaboration and health and all policies include, first, convening a work group that representing statewide interests comprised of citizens, businesses, public health representatives, and other stakeholders to develop a health and all policies plan for Iowa. And second, to create a pilot project to test health impact assessment as a tool within the Legislative Services Agency in order to analyze the health impact of proposed legislation, similar to how they already analyze the fiscal and legal implications. Julie, back to you.
Thanks, Lena. Our third policy priority that we want to speak about is the public health workforce. I doubt seriously again if there's anyone that is on the webinar, plus all of your colleagues across the state, that are not looking at workforce concerns. And we want to address that. We need to address that both for the current situation and as well as we look into the future. The public health workforce shortages are there for many, many reasons. Among those is there's a greater demand for public health services to Iowa's increasing, aging, and more chronically ill populations. Retirements. Those of you that know me, I had 45 years in public health. There are many of my public health colleagues in Iowa that are approaching that and are retiring. Major transformations in the health system. It's the Affordable Care Act. It's Medicaid managed care. The integrated approaches to prevention and public and primary care. The demand for public health workers with different skill sets to accommodate the changing dynamics of public health is critical. Public health departments must maintain or retain a skilled workforce of sufficient size and training to successfully manage long-standing public health issues, as well as the emerging health threats, like prescription drug overdoses, water quality, climate change. And then you have the substantial cost of recruiting, hiring, and training new staff. The gaps in Iowa's public health workforce, as you might expect, are not simply a matter of having enough public health workers or numbers. It's also that we need to have a workforce that has the skill sets required of public health professionals in 2018. Our policy solution, the IPHA policy solution, as we recommend, is to convene a work group to assess Iowa's public health workforce to identify assets and gaps, both in the number of public health professionals and the changing skill sets that I've already mentioned. to identify strategies that align with Iowa's Future Ready Iowa and the National Consortium for Public Health Workforce Development. And thirdly, to support implementation of recommended strategies to address identified public health workforce issues. We have our work cut out for us. I think we're going to go on to Eric and Brian to talk about best practices.
Good afternoon. This is Brian Honoff. I am a member of the Advocacy Committee and also participate as a team member with the Iowa Environmental Health Association. Before I really dive into a few of the best practices and tips for engaging your legislators, I can't help but recognize that aside from the presenters today, we have 13 additional attendees, which is kind of a downer for me personally, I think. So that tells me there's several hundred people out there across the state that we're not talking to today. I really stress to you 13 who are listening to reach out to your fellow colleagues and around the state and recognize that we need to show up in numbers on Wednesday to at least make our messages heard. So I just want to go over a few items, and then my colleague Eric Bradley will also touch base on a few of the 10 rules for advocacy. A couple of things I just wanted to point out first. Of course, it's kind of it's well known you want to dress professional on Wednesday. Suit, tie, suit. If you're a female, if you can, certainly dress appropriate. If you have a name tag, legislators like to recognize who you are by first name, and also it's easier if you do have a formal name tag that you can wear. Bring plenty of business cards with you, and so just wanted to touch base on a few things as far as best practices before the meetings on Wednesday. First contact, you certainly wanted to set up meetings with your legislators and let them know who you are, what our primary concerns are going into the session, and areas that they can help you advocate for as legislators. Tips for a first meeting are certainly important to recognize that you can host meetings with your legislators at your office or meet them for a coffee and talk with them. What that does is help set the atmosphere for a comfortable visit in talking with them. It's about relationship building. Let them know your story, what you're all about, what's important to you, and of course, if you can, reiterate some of the primary points that the association is advocating for during that particular year. You know, let them know that we are serving their constituents. So in essence, we're working together. So point that out. You want to use pictures and testimonials to personalize the impact of your work. It's important for them to really understand where our funding comes from. And it's like most agencies, funding is always tight. And so with state budget cuts that are looming, it's going to be important for you to tell that story, not only this week, but also after this the meeting on Wednesday. You know, when you first meet with them at your office or in your communities, allow plenty of time for questions. They should have questions. And then you want to follow up the next day with a handwritten note. Leading up to the activities on Wednesday, I just want to point out that it's an extremely exciting day. Take in all that you can in that Capitol, the history, take a look around, tour the facility if you haven't before, and just take it all in and get active. During the legislative session, of course, you're going to be attending the Day on the Hill. I'll re-emphasize, make sure you invite your colleagues, get as many people there who have time, the more the merrier. Contact your legislators in advance. So yesterday I personally, or excuse me, on Friday, I sent out notes to our local legislators letting them know that I'm going to be at the Capitol. And if they have time, I would certainly welcome a handshake and a brief visit. Prepare your talking points from advocacy statements created by IPHA and or other organizations that you support. Make sure that you have that material ready for them, so if they request it, you can hand them those briefings for takeaways. When they're in session, legislators' time is going to be very much at a premium, so you have to recognize that. You're going to get a couple of minutes tops. So a quick handshake, talk about the primary points that you want to get through, and again, hand them a takeaway. Always follow up. So on Thursday, following up with phone calls or an email saying thank you for your time, and let them know that you are a resource in the future, that they can reach out to you. And then also recognize that most legislators host formal meetings that will be done generally on a Friday, Saturday, or Sunday when they're not in session. So feel free to attend those informal meetings and let them know that you are there as a recognized professional in public health, environmental health. And with that, I'll turn it over to my colleague, Eric Bradley, where he can talk a little bit more about some tips for the first meeting.
Hi, good afternoon. I'm going to go over the top 10 rules of advocacy. This is put out by the American Public Health Association. First off, you want to get to know the legislators, not just at these events, but like Brian had mentioned, at the informal meetings they have back home during the off season. Basically just to get that relationship built up, so that if a public health bill pops up, they know who they can contact back home. You just want to become a resource for them, that they reach out to you and you're not always having to contact them. You also want to acquaint yourself with their staff members. Typically, if you call, it's going to be their clerk who is going to answer the phone, if anybody answers at all. So you want to also get to know them, make sure they know you are a resource for certain types of bills that come up, so they can remind the legislator who they need to contact. You also want to identify fellow advocates and partners, kind of like with Iowa Public Health Association, IEHA, ICFA, Hygienic Lab, College of Public Health, kind of like we did with the Raw Milk Coalition 8 years ago. We had the 3 main public health associations. We had the IDPH, and we had a couple of dairy associations. And now that coalition sits at almost 30 different organizations from across Iowa. So you want to just reach out to partners that are groups that you might not even think would be interested in what you're talking about, because you never know, you may have some common ground somewhere, and that brings them together for that issue or another issue that pops up. Number 4, you want to basically, yesterday's opponent may be today's ally. You always want to be cordial. Even when you're disagreeing, you want to be nice, be clear and concise when you're talking, but don't become aggressive, don't become defensive. One example of that would be Senator Schultz. He was a representative from Crawford County who year after year introduced the raw milk bill. Well, now he's in the Senate, and he's one of our champions for the food fee bill. So, a couple years ago, we were kind of against him. Today, he's working with us. So you want to foster that. You also want to strengthen any relationships that you already have with other allies and public health allies, the other associations, and any other legislators. Even if that legislator might not be on a committee that your bill is working on, you still want to reach out to them from time to time and just remind them, hey, just check in. If there's anything that comes up, give me a call. I'll be able to answer any questions for you. Always be honest and straightforward. Don't try and BS. If you don't know an answer, tell them you don't know, but you'll find out and get them the information. Be polite. Try to remember their names and always thank those who help, whether it's a legislator or anybody else there at in the public health community. Learn the legislative process. You got the basic stuff where, one bill comes up in one chamber, and then if it passes, it goes to the other. Then, but there's a lot of other stuff that goes on behind the scenes with the subcommittees, and then from one session to the other. So there's a lot of stuff to kind of try and keep up with that most people aren't really aware of. You want to be brief, clear, and accurate. That's whether you're sending an email, you're writing a letter, or you're talking. Like Brian said, they don't have a whole lot of time, so you need to get right to your point of what you want to make. And then again, as Brian said, be sure to follow up and make sure they know that you are a resource for them. And that's all we have on the advocacy part. So back to Janine.
Okay. Thank you, Eric. Thank you, Brian, and Lena and Julie. So now we will shift gears a little bit here. So again, this part, what the planned presenter for this was Deborah Thompson, who is our policy advisor and legislative liaison for the state health department. She's regrets she can't be with us, so I'm going to pinch hit a little here and see if we can cover a few highlights. So Deborah shared with me one of the first things she was going to address. We've already brought up raw milk a couple times here today. There are 3 bills in the legislature active this session. They, as I think Brian or Eric, one of you might have referenced, they, instead of being assigned to agriculture, which is a more logical place for them to go, they have been assigned to local government. And so we do have a little bit of a challenge in that they're in a different spot with folks who might not be as informed about the public health parameters and concerns that we have about allowing the sale of raw milk in our state. So we have registered as opposed, and thanks again to our great partner, the Iowa Environmental Health Association, for keeping us abreast of that issue and really kind of taking the lead on that one. I think some other issues that people probably are wondering about, what about that bill to eliminate the Iowa Department of Public Health? So all of you as IPHA members have received an action alert from us a couple weeks ago now about House File 2017. That bill has been assigned to a subcommittee within state government. In all of my conversations and other conversations that our members have had, the hope is that it has gone there to die and that it will not come out of subcommittee. And I just have to give a huge shout out to our membership. They were so engaged with sending emails and making phone calls to their respective legislators in district to share their story about public health and what it looks like in their district and what the ramifications of eliminating the Department of Public Health at the state level would be. So it's still there, but I think that that was probably not where we need to focus our energy. Probably at this point, we need to be shifting gears, and this is where Deborah was heading with her presentation as well. Appropriations. So it's no secret by now, I had shared in that same action alert with our membership that the governor's proposed budget made some pretty severe cuts to the public health line item, and that's the funding that goes to the Iowa Department of Public Health. But of course, that funding then goes out across the state. And the governor's recommendation was a cut of $462,000 for this fiscal year, so for FY18. And all my conversations with legislators about that were, you'll be lucky if that's all you get. And in fact, we saw at the end of last week, the Senate Republicans put out their proposed budget reallocation for FY18. And in that, which is now, it was a Senate study bill. It's been renumbered. It is now Senate File 2117. The proposed cut to the Iowa Department of Public Health, again, in this fiscal year, is $1.4 million. So that is about 3 times of what we were looking at with the governor's cut. So I am now sharing Deborah's perspective on this. She said that what she would recommend for our members and for others coming to the Capitol for the Public Health Day on the Hill is that we should have no illusion that public health won't take that cut, that cut is coming. And it's probably not terribly productive to go up there and ranting about that cut. From her perspective, the more productive thing to do would take the long view about relationship building, which is something that Eric alluded to a moment ago, and perhaps talking about trying to find the glass half full here and say, so what is it that public health does, and position public health for the long term. When there is money to reinvest back into public health, what does that look like? Where are those dollars most wisely spent? Again, some talking points from that would be from IPHA's policy position statement about rethinking public health for a smarter investment. You could pull from that as well. So I don't think that's probably what you all want to hear. I would also say, by all means, please tell your story. Don't come and think that you're not allowed to talk about the funding cut. You need to share what that looks like back in your counties or wherever in the state you live, and your piece of public health practice. What will those cuts potentially mean? I think it's also important to have the federal cut context in mind as well, but those things are a little less certain. So we want to try to position public health for the long term here and talk about those smart investments. but I think that probably a lot of you have questions about the cuts, and that will probably be front and center. There are also rumors around anti-vaccination efforts. Again, there was a small demonstration last week at the Capitol. There will be one the following week. Thankfully, not on the day that we are there. So IPHA also, as Lena alluded to with showing you our advocacy page, we do now have a new policy position statement around immunizations as well. So I will pause there, and we will go ahead and move into the question and answer feature of our time together. I will just ask all of our presenters if you want to go ahead and unmute yourselves. If there's anything before we take any questions that any of you heard your fellow presenter mention and wanted to add on to that, please feel welcome to do that. And a reminder to all of our attendees that the way to submit questions is through the question feature of the control panel. So hopefully you see that little tab there that says questions, and if you click on that, you should be able to ask your question. Because we are a relatively small group, as Brian alluded to, if you want to raise your hand, I can unmute you as well if you have a question. Okay, Danielle Pettit. Danielle, I'm going to unmute you.
Thanks, Janine. So I have a question about the $1.4 million, because I had guidance when we were looking at about a third of that and where that money was coming from, so that we can better prepare to share stories of what that impact looks like here locally. Do we know where those cuts are going to come from in the department? Have we heard anything?
We don't, and I've had conversations with the director of the department in the last week and such, and expressing my frustration over the lack of granularity that helps us articulate that. Yeah, because so so what Danielle's referring to everybody else's education here, the governor's proposal, she put together, it's a very lengthy document. That document then was presented by the Legislative Services Agency to an HHS appropriates subcommittee a couple weeks ago, and in that presentation there's a specific description of so in essential public health services, this $235,000 cut will be accomplished by X, Y, and Z, and we don't have any of that detail in the budget bill that's put forward by the Senate. So the answer is no, we don't have that. Okay. Now, obviously, the department needs to be doing their work within the executive team to formulate what that would look like, but that level of detail is not in the bill.
Okay, sorry. Thanks, Janine. Oh,
yeah. Okay. No, it's not okay, but
well, yeah.
Thanks. But yeah. Okay. Any other questions? Right. And yeah, it's hard to just say nothing, and I don't want anybody to come and say, well, we were told we weren't supposed to. That's not at all the case. By all means, share your story, but then let's also, to that long view, position ourselves in relationship building mode and talk about the value of public health. This is a good point for me to plug the work of the Advocacy Committee with the No Public Health campaign and the success stories that are published, and you will have copies of those at the Day on the Hill event at the IPHA table. All of your name badges, when you come check in and write your name on a name badge, those name badges will all be labeled with the hashtag No Public Health to try to build that brand around the value of public health. Okay, we have another question here, just a moment. Yeah, so Jeremy's asking, any movement on the cigarette tax increase? Thanks, Jeremy. That's a good question. Okay, yes, there is. So just to refresh everybody's memory, and I will go ahead and pull up here so you can all see. We have, for those of you who attended our legislative forum, you know that, but we have a coalition in the state of Iowa that has come together since last summer to begin working on raising the cigarette tax increase. That is one of the three most effective pillars of tobacco control, is regular and substantive increases on tobacco pricing. So the coalition is working to raise the cigarette tax increase by $1.50 and has some pretty good data pulled together about what the impacts of that increase would be in terms of 15,500 kids not starting tobacco use, the impacts on the number of people moving towards cessation. And so really it's a public health strategy in and of itself. However, of course, in this budget conversation, new revenue streams or increased revenue streams are always a welcome conversation with legislators too. So Representative Rob Taylor did introduce a bill for drafting, and it would be at the $1.50 tax increase. The proceeds from that new increased revenue in his version of the bill would go to tobacco control, increasing tobacco control by $9 million. Still doesn't get us to where CDC says we should be, but that would be getting us back to the highest it's been in Iowa. And then the rest of the revenue in his bill would proposed to go towards mental health, which there's quite a need as well. Having conversations with other public health advocates, maybe feel like that money should go in other areas as well within public health. But it was a win to get a Republican legislator to introduce that bill, and Representative Taylor seems very interested in the issue. So that's some progress anyway. So thanks for that question. Other questions, or you can raise your hands. I know that I just want to give a shout out to the students who are on the webinar today. We have a large number of students we're hoping to join us at the Capitol for the Hill Day on Wednesday. And for those of you who haven't been to the Capitol, hopefully Lena's overview of just sort of the lay of the land will help you feel a little more comfortable. The other piece is we want you to just know that you can just come see me at the IPHA table when you first get there, and we'll just kind of talk about how to get you up to the chambers and maybe pair you up with somebody who has a little more experience under their belt and walk you through how to call out your legislator, how to fill out that form and go through that process. But I can't emphasize enough, I think it was Brian who shared the idea of letting them know before you come. If you just send them a quick email today or call them on the Capitol switchboard and just say, hey, I'm making the trip to Des Moines, would love to see you. Our session, we have the rotunda space from 11:30 to 1. And it's kind of a good thing and can be a challenge. It could be that they head out for lunch and you won't miss them. If you tell them beforehand that you will be there and ask them to stop by, or you maybe even schedule up a separate meeting with them around that, around our rotunda time, that's a really good strategy to make sure that you will get to see them. Eric, Brian, Julie, Lena, other things to add?
This is Julie, and all I can say is just echo what you have already said and some of the other presenters, in that it is so important that those of you on the webinar share some of this information with your colleagues in your geographical area or statewide, but to share this information, and that you take the stories of public health and get them to those copies, get them to the Day on the Hill if you're there, either in person or virtually. They need to hear and better understand what public health is in the state of Iowa.
Very good. Thanks, Julie.
And this is Lena, and I definitely echo everything Julie said. But and while this focus on the Day of the Hill is obviously at the state house level, we don't want to forget our Board of Health folks out in the counties, and the same messages that we're giving to the legislators of the state capitol need to be heard by our Board of Health folks as well.
True, and back up the other direction at the federal level in Iowa's congressional delegation. Thanks, Lena. Brian or Eric?
This is Brian. I'll just go ahead and emphasize that the people who represent us at the Capitol certainly don't walk on water any more than anyone on the call. So don't be intimidated by approaching these people. If there's students on the call, you know, if you have questions about that process, by all means, ask other people who are there. We're happy to talk you through that process and really understand how it works. The sooner you learn it in your careers, the more effective you'll be as time goes on. So, you know, just talk to these people like they're your neighbors or your friends or colleagues. That's what they're looking for.
And this is Eric. I'll just add that most of the ones you're going to talk to, public health is not their passion. So you've got a very few minutes to not only explain what you want from them, but also kind of explain how this affects the public's health. So you've got a lot of work ahead of you.
Okay, last call for questions. Okay, and just want to point out before we start to wrap up here, there are handouts available. So if you're again looking at that control panel, that docking station there is a tab for handouts, and there are 3 handouts there, the slides from today's session, and then 2 of the handouts that were referenced as best practices by Eric and Brian. And so with that, we will go ahead and wrap up. A huge thank you to Lena, Julie, Eric, and Brian, and Deborah and Spirit for their remarks and time to help us prepare for the 2018 Public Health Day on the Hill. We thank everybody for joining us. If you've not yet registered for the Public Health Day on the Hill, I just reopened that registration on the IPHA website. Just thought maybe there'd be a rush. So I've had a few emails about it this morning, so I reopened that. Please go ahead and go out there, click on the events tab. So that's iowapha.org, and then click on the events tab on the left side of your screen. And of course, if you are not yet an IPHA member, we invite you to join us. Information on membership is also found on our website. Thank you and have a great rest of your day.